It's going to be a path-breaking victory. The first woman president, Kamala Harris.
Some predictions don't exactly age well, and the same is true in healthcare. Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today I want to talk about how the initial assessment may not turn out to be the most accurate. This is certainly the case when trying to predict the results of a national election, and it's also the case in the practice of medicine. For example, let's say you go to see your doctor for a specific complaint. Maybe it's a fever that's been ongoing a couple of days, hasn't gone away. Your doctor will do a very thorough investigation to try to figure out what's causing this fever. It starts with a medical interview. He or she will ask you, when did the fever start? How high did the temperature get? Any associated symptoms like cough, stomach ache, nausea, vomiting, etc. So big interview to start this off. Then on to the physical examination, where he or she will check vital signs. So that's temperature, heart rate, respiration rate, blood pressure. And then with something as vague as a fever or as non-specific as a fever, who knows what's causing it, right? So the doctor is going to do a very thorough physical exam, starting kind of head to toe, looking in the mouth and the throat, looking for any ulcers or exudate in the throat. Then onto the heart. The doctor will listen to the heart, listening for irregularities in the rhythm or any new murmurs, whooshing sounds that can indicate an infection involving the heart or actually the heart valves. Then listening to the lungs, you're trying to pick up clues for pneumonia, so new wheezing, crackles in the lungs. Then onto the belly, see if there's any tenderness, especially on the right side, which could indicate an infection in the gallbladder. Then a thorough skin exam to see if there's any rashes or other signs of skin breakdown, which could be places where bacteria could enter the body. So a very thorough physical examination. Then based on what the doctor finds in the interview and the physical exam, he or she may order other tests like laboratory tests. These could be blood tests or urine tests. Also, maybe imaging studies, maybe a chest x-ray if there was a cough or any wheezing that was new. And finally, after all of this, the doctor will take any information he or she was able to gain from that rather convoluted process of the history, physical exam, and any other tests that were ordered, and using that information come up with an initial impression or initial diagnosis. So for a symptom of fever, maybe that initial diagnosis is upper respiratory tract infection, right? Very common. Viral URIs happen all the time. Or maybe in the process of the medical interview, the doctor was able to figure out that there's been some urinary changes, increased frequency of urination, and maybe on the physical exam, there's some tenderness in the sides of the abdomen. A possible diagnosis could be pyelonephritis or infection of the kidneys. But here's the thing. It's never 100%, especially on that first meeting. The doctor's only spent 15-20 minutes with you. That initial impression could turn out to be wrong. So for that reason, doctors always say if the symptoms don't get better, definitely it's a good idea to follow up in 1 week, maybe 2 weeks, at which point the doctor can then look for other potential explanations for your symptoms. And these explanations can get a little bit more esoteric. So we always say horses and zebras, right? You look for horses first, they're more common. Those are things like upper respiratory tract infections, UTIs, maybe appendicitis, bacterial and viral infections. But zebras, more unusual causes for fever would be things like undiagnosed malignancy, leukemias, for example, or even something as exotic as some sort of hematologic abnormality. Well, I guess leukemia is a hematologic abnormality, but something else like hemophagocytic lymphohistiocytosis, right? This is a more rare condition. Nobody's going to look at this first. You're not going to hear fever and think, oh, this is hemophagocytic lymphohistiocytosis. Hands down. No, that's really something that you consider more once you've worked up more common causes of the fever. In my case, I work as a hospital medicine doctor. I only work in the hospital setting, so I follow patients throughout their entire hospital stay. I have more time. I'm not just going to spend 15-20 minutes with the patient and then that's it. And so because of that luxury, the luxury of time, I can take the initial impression, the diagnosis that was made usually in the emergency department, and then see if that proves to be true over oftentimes several days of a hospital stay. So I think I have it a little bit easier than many doctors who would rely on follow-up in a couple weeks or maybe a phone call to follow up. Okay, that's about all I've got for this video. If you enjoy healthcare related content like this, feel free to hit the subscribe button there or check out another video here, and I'll see you guys next time.